All right, looks like we're ready to go. Well, hi everyone, welcome. Welcome committee members. We're really excited to get to say that. Thank you for making the time to be here today. I'm Cody Zeger. I'm the Director of Statewide Policy here at the California Interagency Council on Homelessness. And I have the pleasure of opening our meeting today. We're going to do a few reminders before we begin. This is a 1-hour meeting and we'll do our best to keep to this time frame. In the future, our meetings will likely be longer, but this shorter time frame sort of helped us get everyone together more quickly onto a call. This meeting will follow the requirements outlined in the state's Bagley-Keene Open Meetings Act, which governs meetings of public bodies such as this advisory committee. You all received a summary of Bagley-Keene in your briefing packet, as well as a link to the full text of the law in the reminder email about this meeting. And per Bagley-Keene, this meeting will be recorded and published on our website for the public to view. So our goals for today's meeting, as you can sort of see on the agenda here, are to help really focus on two things. One, to introduce members to one another, so you all can get to know each other a little bit, and so that we can get to know you, as well as to provide you with enough information on Cal ICH to sort of help direct your future conversations about this group's priorities. So given those goals, we have a lot of ground to cover in 1 hour, and just want to thank everyone in advance for your patience as we provide you with a lot of information during this meeting. In future meetings, I promise there will be much more time to have discussion between committee members and conversation, but this one will be relatively information heavy today. We'll start today by calling roll, then we'll hear from our Cal ICH co-chairs. After that, committee members will have the chance to introduce themselves. And finally, I'll provide some background information about Cal ICH and this advisory committee. At the end of the meeting, there will be an opportunity for general public comment as well. And prior to this meeting, committee members were provided with a briefing packet, which is also available to the public on our website. I'll try to leave some time for committee members to ask questions toward the end of the meeting. But if we run out of time, just please feel free to reach out to us, Cal ICH staff, with any questions after the meeting. So with that said, let's get this meeting started. The first ever meeting of the advisory committee to the California Interagency Council on Homelessness is hereby called to order on this day, October 17th, 2022 at 11:05 a.m. Will Cal ICH staff member Giselle Sanchez please call the roll?
Yes, when I call your name, please say here or present. Ludmilla Bade. Al Ballesteros.
Present.
Oh, thank you, Ludmilla. Al Ballesteros.
Present.
Doug Bond.
Present.
Samantha Bapko.
Present.
Carolyn Coleman.
Present.
Joe Coletti.
Present.
Charlene Dimas Peinado.
Present.
Wiebke Einsen.
Here.
Dora Gallo.
Here.
Jennifer Hart Dietz.
Present.
Eric Harris.
Here.
Charles Helget.
Present.
Janet Kelly.
Present.
Jody Ketcheside.
Present.
Margot Cushell.
Present.
Philip Mangano.
Present.
Chris Martin.
Present.
Mariah McGill.
Present. Good morning.
Luana Murphy.
Present. Good morning.
Alyssa Orduña.
Present.
Sharon Rapport.
Present.
Janie Roundtree.
Present.
Emilio Salas. Miguel Santana. Doug Shoemaker.
Present.
Sean Spear.
Present.
Reba Stevens.
Present.
Megan Van Sant.
Present.
Alex Bizotsky.
Present.
Javon Wilkes.
Present.
Roxanne Wilson.
Present.
All right, we do have 29 members here. We have a quorum. We could continue with this meeting.
All right, amazing. Thank you all for being here. Really, really excited. And thanks, Giselle. Before we move on to our next agenda items, agenda item, I just have a few logistics to go over to help the conversation run smoothly today. I'd like to remind all members of the public that we take public comment after each action item listed on the agenda and at the end of each meeting. So since there are no action items on today's agenda, we're going to save public comment for the end. To ensure everyone is given a chance to speak who would like to, we allow for a maximum of 2 minutes for each comment. Our team will put a 2-minute timer up on the screen and give you a warning when you have run out of time. We welcome all public comments and feedback, but however, due to the structure of the public meeting we're in, we may not be able to respond to comments. For this reason, if you have any specific questions that you would like answered, we ask you to please email us at calich@bcsh.ca.gov. And we'll put that email up on the screen at the end of the meeting. So I will now turn to our co-chairs for their opening remarks, starting with Chair Secretary Castro Ramirez.
All right, fantastic. Cody, thank you so much. And thank you to the team that pulled this together. It's so exciting as each of you were being announced and your camera would come on. It's so exciting to see so many talented, committed, hardworking individuals being part now of this advisory committee. Both Secretary Galley and I, and of course, our boss, Governor Newsom, are thrilled that you've accepted the invitation to be part of this effort. As mentioned by Cody, I'm Lourdes Castro Ramirez, Secretary of California's Business, Consumer Services, and Housing Agency. And I have the pleasure of co-chairing the California Interagency Council on Homelessness, along with my colleague, Secretary Galley, who I believe has joined us. It is our pleasure to welcome you all to the newly established advisory committee to the California Interagency Council on Homelessness. This is a statewide council that is charged with forging more collaboration among state agencies and departments and ensuring that we're doing our best to model the kind of collaboration that we would like to see at the local level. I want to thank each of you for your dedication to preventing and ending homelessness in our state, whether it is in the delivery of services at the local level or within statewide policy, or as you continue to advocate for people experiencing homelessness. You're all improving the outcomes of the homelessness response system and pushing forward important changes. This committee has been a long time coming, as many of you know. We have known that this group would be formed since Assembly Bill 1220, which was signed last year in 2021. And the goal was to bring the skills, expertise, and lived experiences of the most thoughtful and dedicated individuals working to prevent and end homelessness. We were very intentional about embedding equity, diversity, and inclusion into the process of establishing this committee. As a result, we have a diverse set of committee members with a wide variety of experiences and expertise on homelessness. We have created a group that can touch on the many facets of homelessness, advocate for populations who are overrepresented in unsheltered homelessness, and a group that is geographically representative and reflects the diversity of California. So we're very proud of the fact that we have a council advisory committee that will advise the council that represents the diversity of our state. Again, we're impressed by the breadth of experience and the expertise of this group of 31 members. This committee is most equipped to provide guidance and feedback on our state's efforts as we continue to stay focused on solving unsheltered homelessness and continue to hold each other accountable for the implementation of best practices and strategies. The same legislation that created this advisory committee, AB 1220, also led to the restructuring of the Homelessness Coordinating and Financing Council, also known as the HCFC. And so the restructuring led to the creation of this statewide council. The council is comprised of 18 leaders from state agencies and departments, one community leader appointed by the Speaker of the Assembly, and one community leader appointed by the Senate Rules Committee. The statewide Interagency Council is led by co-chairs from Health and Human Services, Secretary Galley, who you will hear from in just a minute, and the Business Consumer Services and Housing Agency. And we're very much focused on lifting up this housing and health framework, a comprehensive approach to addressing homelessness. This allows for greater state coordination in the council's policy making, aligning our state programs and resources, and also the strategies to drive greater impact of state programs and greater progress in local communities. We're also focused on strengthening our housing first approaches across the state as we provide funding and administer and provide oversight of housing and homelessness programs. We're just recently, the statewide council adopted the update to the action plan for preventing and ending homelessness. This is the plan that will guide our work and also will guide how we're measuring our impact. In just a few minutes after we hear from my colleague, Secretary Galley, Cody will be presiding over the swearing in, and we're just, again, filled with enthusiasm and excitement that you all have joined and accepted the call to be part of this effort. We look forward to this committee meeting on a regular basis. We look forward to your input and your feedback as the council continues to do its work. And we're confident that this committee will provide very necessary and helpful insight and feedback on the work that we're doing across the state. Thank you again for your dedication. And now I will go ahead and pass this over to Secretary Galley. Thank you.
Good morning, folks. Lourdes, thanks for the welcome and just the comment spot on. Let me just start by thanking friends, colleagues, Dakshika in particular, Corinne in particular, the teams that put this star-studded crew together. It really is. I know when I received the list, I started at the top and was like, oh, yes. By the time you got to the bottom of the list, you really appreciated how thoughtful this group was put together. The range of experiences and perspectives and responsibilities in local communities is pretty big. You have some of the best researchers and academicians on homelessness in California. You have service providers that come at it from a health bent, come at it from a social services bent. You have leaders locally who are on your local boards. You have housing developers who are innovating. You have national organization leaders. It's quite a crew of individuals that I'm excited to see where the work that you all push on takes us. As Lourdes mentioned, the council has a pretty big job in front of it. We're moving from a place where we want to stop only talking about the billions of dollars invested to end homelessness in California to the accountability structures, the framework that's going to move the programs forward. And we know that this doesn't happen at some stale table or Zoom meeting from Sacramento, but it happens in communities where, Reba, Javon, a number of you who I know carry that conversation forward in really meaningful ways that you're going to take what happens in this advisory council, bring it back into communities and bring that through a cycle back to us. I like to think about our role on the council as trying to connect the dots in a lot of places. And there's so many dots to connect right now. It's hard to keep track of them all. But the truth is there's a whole bunch of dots that we're not even seeing yet. And I think your eyes, your ears, your influence, your sense of equity, your sense of disparities are going to help us see dots that we don't see today. And when I think about where this council can go and the ability to take investments over here and combine them with investments over here, and it's not just, 1 + 1 = 2, it's 1 + 1 = 3 in the math of how we figure out the leverage and the opportunity to bridge programs and investments from the state or from the counties in communities where this can really make a difference. I'll also say that I know not everybody sees the problem the same way, right? You see it from your unique perspective. You bring your own experiences. You bring not just your place on the block, but the number of times you've been around the block to this effort. And I'm really looking forward to seeing how you push us to be better, to be more accountable ourselves, so that we can take the resources that California is blessed to have, the brains that we are blessed to have, to solve one of the most challenging problems in California, but one of the most important. I had a chance to spend a little time with the governor last week talking about health broadly speaking, and we couldn't really have 10 minutes of a conversation without talking about this issue. And so I'm excited again about the work you're going to do. I'm motivated by the fact that you all signed up to give us a little bit more of your time. I mean, I know you all probably have a little ledger on how much free work you're doing for California State, but we are deeply appreciative of that because that helps us move forward on the hope that every Californian not just has a place to sleep indoors at night, but they have a true home, that it's linked to all the things that give them purpose, that give them attachment. And we move from a place of where we're not just talking about inclusion, but we're really talking about belonging to a community that really pushes our wellness forward. So thanks again for your commitment, your contribution already, and what you're going to do for us moving forward.
Great, thank you. All right, so thanks so much to both of our co-chairs for your comments. And again, thank you to our committee members for being here. Since this is our first meeting, we're gonna move towards spending, the bulk of the time to letting committee members get to know each other. As you might imagine, with 31 members, this could take, more than an hour-long meeting to do really deeply. However, we'd like to offer you the opportunity to introduce yourself. So we're going to do a little bit of a facilitated introduction style. So I'm going to give everyone a minute to think, but I think on the next slide, there is a prompt. Yeah, here's the prompt on the screen. So just take a minute as I'm talking here, think about a California in which we have effectively prevented and ended homelessness. What is one tool, approach, or area of focus that you believe is central to this vision? So keep thinking about it, and as I'm going to call on people in alphabetical order the way we did before. And as we call on you, just please state your name, your title, the organization you're affiliated with, if any. And then this one tool, approach, or area of focus that you believe is central to a future in which we have effectively prevented and ended homelessness. Our big challenge, please everyone try and keep your remarks brief if you can. One word or one sentence will do for now, as we can have a chance to dive more deeply into these topics in future meetings. And I hope that we will spend some time doing that. So I'm just going to pause and give everyone a minute to think about this before I start calling on committee members. Okay, I'm going to get us started. Apologies to those in the beginning of the alphabet who are asked to go first. Maybe next time we'll go the opposite direction. So apologies in advance if I mispronounce anyone's name. Please feel free to note the correct pronunciation when you respond. And we will start with Ludmila Bade.
Good morning. It's an incredible honor to be part of this. I am a person who has experienced homelessness. I'm an older person, and I believe that one of the most essential dots, one of the big dots that we need to connect, is communication and collaboration. And I would really love to see increased social skills in nonviolent communication instead of blaming as one of the tools that's used to have neighborhoods and communities and the homeless community be able to work together to come up with solutions, and for places, as was mentioned, where that home is not just a place to put your body, but a place to feel included, welcomed, and to have purpose, and to be able to contribute to the rest of the community. Thank you.
Thanks so much. Really appreciate it. Al Ballesteros.
Yes, good morning. Thank you very much, Secretary Castro Ramirez and Secretary Mark Galley, for this opportunity to be of service. So I work with a large organization that has services for the homeless in Skid Row, Los Angeles. We provide medical services as well as interim housing focused in the area of recuperative care, as well as low barrier interim housing for individuals that are accessed on the street or in other settings where they may reside. One of the areas that I think that would, that's important to answer your question would be collaboration and well coordinated systems and programs. But most importantly, when you look at that, is the glue, if you will, and the systems and the support to make those collaborations work, which ultimately comes down to a workforce and people to help the systems work. One of the things that I've seen a lot of is that there are systems in place, but sometimes figuring out how to get individuals into systems that can assist, we sometimes lack the coordination pieces. And I think that sometimes that relates to workforce and investments in those particular areas. So thank you very much. And it's good to see a lot of the people here that I work with and new individuals that I will get to know over the course of this council advisory body. Thank you.
Thanks. Samantha Batko.
Hi, everyone. Honored to be a part of the group. My name is Samantha Batko. I'm a principal research associate at the Urban Institute. And I think that, in my view, an area of focus that's central to the vision of ending homelessness in California is the development of deeply affordable housing.
Thank you. Doug Bond.
Thank you. Doug Bond, President, CEO, Amity Foundation. I want to thank Secretary Castro Ramirez and Secretary Galley. It's wonderful for your leadership on this. Also, a lot of familiar faces and a lot of new faces that looking forward to getting to know. We're a service provider that serves over 30,000 people in California that are justice impacted in treatment settings, residential settings, housing developer, employment services. I would say one of the things is the inclusion of individuals that are system impacted, that are coming out of institutions. The definition of homelessness is a big barrier. Ideally, we want to do more prevention for homelessness. And I would say one other thing is just early childhood trauma, to really get in front of things. I would say as somebody that's actually been through Amity as a foster child that was able to reunite with his parents, and then a struggling young 26-year-old that was able to go through Amity services. Those things are extremely important for the multi-generational impact to the community. Thank you.
Thank you, Doug. Carolyn Coleman.
Good morning and terrific to see everyone, to Secretary Castro Ramirez and Secretary Gawley. Thank you for inviting cities to be a part of this important conversation. I truly believe, and I believe you all do as well, that cities have an important role in helping us address this challenge. If I had to pick one important tool that we could focus on, it would be partnerships that are built on trust. So thank you for including me, and I look forward to being a part of this important work.
Thank you very much. Joe Coletti.
Good morning, Joe Coletti, Urban Initiatives. What you're going to hear from me a lot as we go forward is trauma-informed care in light of SB 914 recently being approved, which focuses on unaccompanied women, SB 914, and also hear from me, as you have in the past, about mortality prevention. Matter of fact, just real quick, Cody, I want to thank you and Matthew Doherty for connecting me with CDPH, a couple of so many weeks ago in regards to mortality prevention and the action plan. And I had a very good conversation with CDPH staff going forward. And as for the council, if you remember back a couple meetings ago in May, I was briefly mentioning during public comment about mortality prevention and a report that I was working on about 1,000 women who died while homeless in Los Angeles County during recent years. I want to encourage, as I did then, I want to encourage us now is to give these 1,000 women a voice and to give a voice to all the persons who died while homeless throughout the state in recent years, and even to give a voice to all of the people who are homeless as we speak, as we meet, who are vulnerable to dying on the streets. Let's give a voice to all of them by including mortality prevention in the action plan.
Thank you. Charlene Dimas Penado.
Good morning. I'm Charlene Dimas Pinaldo with Wellness, President and CEO, and thank you for the opportunity to serve on this advisory board with so many of our esteemed colleagues. As mentioned, Wellness was established in 1924. It is a trauma-informed mental health agency that also provides transitional and permanent supportive housing for transition-age youth. Our overall population that we serve are children from birth to age 25. And we serve the greater Los Angeles area. We have 7 locations. I would like to, as many of you probably feel the same way, see that there is more generous support to provide a more comprehensive, integrated approach to housing, centrally located in our housing development, whether it's permanent supportive housing or scattered site model. As many of us know, access to these critically needed services are of the utmost importance. And that type of support will help us to ensure that those individuals that we're housing can be successful and stably housed. Thank you.
Vitka Eisen.
Hi, everybody. I'm very honored to be on this with this group and again, see old faces and looking forward to making new friends as well. I'm the CEO for Health Right 360. We're a healthcare organization serving people with shared experiences, typically of substance use disorder and or mental illness, most of whom are currently or have experienced homelessness. We're based in San Francisco, but we provide services throughout the state, through 10 different counties. And we served about 44,000 people last year. And when I saw the prompt, I was like, okay, what am I missing? isn't it housing? I'm like, sorry. I was like, I took it really simply and I was like, one tool to approach is making sure that everybody has housing. So then I thought maybe really the issue is we don't have an agreed upon right to housing in California. Like it's not an agreed upon principle. It's not a legislative principle or that everybody has a right to housing, that this is intolerable, that people don't have housing and that there isn't sufficient affordable housing, and that people who work in our organizations and work in Al's and Doug's, and I know because I know the work you do, struggle with being able to be housed and do the kind of work that they do. And so we don't. So obviously there's worker pay issues, but a basic right to housing seems to be a pretty fundamental issue. And as a healthcare service provider, where we do lots of amazing work in like improving people's health, that all that work is like goes by the wayside if you can't guarantee somebody housing, a safe place to be, a safe, stable, predictable place to be. So at the risk of being really simple here, it's housing. Thanks.
That's great, thank you. Dora Gallo.
Hi, I'm Dora Leon Gallo. I'm with a community of friends, a support housing developer based out of Los Angeles. And I agree with Victor. I'll make it really simple. That one tool that's central to preventing and ending homelessness is permanent supportive housing. And if you want to go a little deeper, project-based vouchers and ongoing services funding. Thank you.
Thank you. Jennifer Harp-Dietz.
Hi, everyone. Thank you so much for inviting me here. I'm honored to be part of this group. My name is Jennifer Harp-Dietz. I'm the CEO of PATH. We are a statewide nonprofit homeless service provider and housing developer. And I would definitely put the emphasis, if we were in a text message, on housing, more affordable housing. And I think to go as far as to state a right for housing would, I think, really push all entities to have to create that plan, since we know there's not enough units. So I'd like to emphasize that.
Thank you. Eric Harris.
Yes, good morning, everyone. I'm happy to be here, and thank you, Cody, and thank you, Secretary Galley. I am the Director of Public Policy at Disability Rights California. We're a statewide nonprofit protection and advocacy organization that provide free legal services for people with disabilities throughout the state. I also have my own lived experience with a physical disability. So along with the very obvious answer of housing, I'm really glad that we got back to the basics of just stating that housing would be a key piece here. I really want to make sure that we also, not just this group, but just the legislative process generally, continue to lift up the voices of the most vulnerable. We know that a lot of folks who are unhoused are people with disabilities, all types of disabilities, whether they be mental health disabilities, intellectual or developmental disabilities, physical disabilities, or a combination of all of them, sensory disabilities, and especially among that group, Black and Brown people. I think that we, all the folks who are here know that that's the case. We've been saying that that's the case. We've done reports. We have data that shows it. And I think that it's now a matter of, okay, well, what are we consistently doing about it to make sure that those people in particular are focused on, because those are the ones that are repeatedly going through a process that is very challenging and repeatedly ending up at the end of the day unhoused. So I just want to make sure that remains a key focus for us as we do this work.
Charles Helget.
Good morning, and thank you all for your leadership. I'm Chuck Helget, the Executive Director of the California Association of Veteran Service Agencies, a veterans advocacy organization statewide organization composed of housing and supportive service providers for veterans in California. And I would suggest that a key component for any housing program that should be advocated by this group is effective funding and effective supportive services. I think this has been mentioned by others, and I would like to echo that as well. Thank you.
Janet Kelly.
Good morning, everyone. It's a pleasure to be a part of this committee. My name is Janet Kelly, and I'm the Executive Director of Sanctuary of Hope. And what we do is provide youth development and human services for young people between the ages of 16 and 25 who are child welfare or justice impacted, housing or economically insecure, or just simply at promise. We're located in South Los Angeles as well as the South Bay, and are in the process of opening our brand new center in the Antelope Valley to provide a regional response to young people who may find themselves in a crisis. So when I think about a tool or approach or area of focus for this council, because a lot of the work that we do is really rooted in racial equity, justice, and working with predominantly young people who are BIPOC. We would hope that cultural community informed practices are a part of the approach, because we see and affirm that it's one of an integral tool and a way to ensure that many of our populations, especially when we talk about Black people or Black and BIPOC, or how one may identify as a person of color, is really essential to preventing and ending housing instability and housing insecurity. And it aligns with the ultimate goal that's been set out in your plan to ensure that it's rare and non-reoccurring.
Jody Ketcheside.
Good morning. My name is Jody Ketcheside. I'm the Deputy COO for Turning Point of Central California, overseeing our housing programs for people experiencing homelessness. And you'll probably hear me say this a lot over however long we're doing this. I think that we, as a state, any state funding that allocates to rural communities is by far too low. Point in time counts are difficult in rural communities. They're incredibly inaccurate, and a vast undercount of who's actually out there. And as a state, we desperately need to increase the allocations to rural communities. Oftentimes, it's just not enough to do much with it all.
Thank you. Margot Kuchel.
Hi, good morning. Nice to be here. I'm Margot Kuchel. I'm a practicing physician and professor of medicine here at UCSF, where I direct the UCSF Benioff Homelessness and Housing Initiative. And even though I'm a physician, I'm going to say it's all about the housing. And I hope to see us closing that gap where we currently have 23 units for every 100 extremely low income household. And I think our first thing is to close that gap, not just of affordable housing, but of housing that's affordable to our lowest income households. Thank you.
Thanks. Philip Mangano. Philip, if you're speaking, we cannot hear you.
There, I think that might solve that problem.
There you go, yep.
Mangano, I head up the American Roundtable, which is a national advocacy organization. And I'm very happy to be part of this advisory group. Especially appreciated the comments of the two secretaries in terms of the nature of the work that we need to do together. I think if there's one overriding theme, it's probably the integration of what we already have. We have a Home Key, which is the most significant homeless initiative in our entire country, creating housing that is specifically targeted to homeless people. And as Margot just said, our effort is not around affordable housing. It is around housing that is affordable to homeless people. So that integration, we have a nexus point in Home Key, wherein employment resources can be brought to that population as well as health resources. And I think too that integration, I think about our veterans and the importance of ensuring that all of the resources that are currently available in California are made available for veterans. There are something on the order of several thousand HUD-VASH vouchers in Los Angeles that are unutilized and about 5,000 across the state of California. So our work is not simply with looking inside of California, it's also looking to the federal agencies who have resources that lie dormant. The other aspect of the work that we do, and in fact, I'm currently out of our state, California, because I'm out in Massachusetts for a national convening around the specific issue of unaccompanied women. We have folk from all around the country who have been brought together at Harvard to talk about that issue. And what the research is telling us is that that population, which was once just a few years ago, 1 in 4 of all adult homeless people, is now edging up on 1 in 3 of all homeless individuals. So there needs to be a lot of emphasis on that population in terms of the gross inequity that has been part of that history for many, many years. Thank you.
Thank you. Chris Martin.
Thanks, Cody. Great to be here with you all. I'm Chris Martin, the Policy Director with Housing California. We are a statewide affordable housing and homelessness advocacy organization. I think it bears repeating, even though it's pretty simple, that housing is the foundation for ending homelessness, be it through deeply affordable housing, supportive housing, created through rental assistance, what have you. We need to emphasize that housing is the foundation for ending homelessness, and I'll leave it there. Thanks.
Thanks. Mariah McGill.
Hi, good morning. I'm Mariah McGill, and I work as the Housing Development Construction Manager at Northern Circle, Indian Housing Authority. We are a tribally designated housing entity that works on behalf of 7 federally recognized tribes in Northern California. In recent years, we've expanded our housing programs to include social services. Our motto here is hope, healing, and housing, and to truly meet those 3 things, we need to have social services. We need to do homelessness outreach and offer housing opportunities and bridge the divide between local jurisdictions and tribal members. I had heard in the conversation earlier very, very important points about BIPOC communities, and they're always left behind. And one of the things that I say about tribal communities is what's more rural than rural, that's tribal. So I'm here on behalf of the tribes that we represent here at Northern Circle to offer a view of what homelessness looks like in tribal communities, and to hopefully open the door for tribal leaders to have a seat at the table, to be present. There's 109 federally recognized tribes in California. And in order to ensure that we're doing equitable outreach, all 109 need to be at the table and need to be representative, because each are their own forms of government. So I'm here hopefully to bridge that divide, get the word out, fight with alongside you all, and try to figure out ways that we can mitigate, prevent, and solve homelessness. Thank you so much.
Thank you. Luana Murphy.
Good morning, everybody. Again, thank you so much for being part of this august group, to say the least. I'm the president and CEO of Exodus Recovery. We see about 40,000 people a year across California. And my husband and I, Dr. David Murphy, established Exodus a little over 30 years ago. And he was an addictionologist, a recovering physician, and thought that the most important thing that we could do for people was to do whatever it took, whatever it was needed. And that was long before we heard the statement of whatever it takes. And housing has always been one of the most important things. We run crisis stabilization units, sobering centers, street outreach, FSP programs. We have hundreds of housing units. And I can tell you that there's lots of needs. But in our crisis stabilization units, in our inpatient units, in our street outreach programs, the most important need is a place to stay, is a place to call home. And we need all kinds of housing. From my perspective, when we're treating all of these emergency cases, people that are coming to us right off the street from law enforcement, from street outreach teams, the most urgent need is we need a place to go right now. We need no barrier places, interim housing, shelters that we can admit to 24/7 with services attached. Then we can move people off the streets into more permanent housing with the social service help. And I have one more thing to say, and that is, I think we have a lot more in California, a lot more services in California than we really take advantage of, because we don't interconnect everything. I heard Dr. Ghali talking about connecting the dots. We don't all know what the dots are, and that's important that we gather that information so that we can get the people to where they need to be. And I am delighted to be here. Thank you.
Thank you. Elisa Orduña.
Hi, good morning, and thank you for allowing me to be here today. I'm excited to be with this group. I know some folks and seen other names, so I'm really kind of like, oh my goodness, this is like a celebrity table for me. So I'm excited. My name is Elisa Orduña. I have my own consulting firm called Florence Elise Advancement Network. It's named after my two grandmothers. I say I'm a recovering public servant staff person, having worked for elected officials in Philadelphia, the city of Los Angeles, and the city of Santa Monica. In my consulting firm, one of the focuses is building up collaborations between cities and the counties that they're in so that we can open up those doors and streamline systems so there's low barrier access across the system. And I agree with what everyone else said. So I'm going to say not necessarily my top priority, although it's hard to prioritize, but what I haven't heard yet is staffing. And that's both recruitment, the diversity of staffing, and the wellness of staffing. I'm hearing too many and speaking with people in the community and organizations and that are still unhoused, where people are having multiple case managers in like a period of 6 months. And that's interrupting the trust that people have of all the services that we're doing and breaking consistency. So I'm going to put staffing on the table. Thank you.
Oops, I was muted, sorry. Thank you. Sharon, report.
Thanks, Cody. Good morning, everybody. I'm Sharon Report with the Corporation for Supportive Housing. We're a national nonprofit working to prevent and end homelessness, and I work specifically on state policy in California. So good to be with you. Really appreciate the invitation to join. I think I agree with what so many people have said and think housing is critical. I think in order to fund evidence-based housing and services, we need ongoing funding. And so I think that's a critical tool California is missing right now, and I'd like to throw that on the table as well. Thank you.
Thank you. And I just want to acknowledge, I know we're over time for this section, but that's okay. This is our welcome meeting. We want to hear from everyone. So if people are able to hang on and keep listening, and we're adjusting the agenda as we speak to make sure that everyone gets a chance to introduce themselves, because this is really important and great to hear everyone's introductions. Thanks, Sharon. Janie Roundtree.
Hi, everyone. Nice to see many of you again. I'm Janie Roundtree, the Executive Director of the California Policy Lab at UCLA. We're a research center focused on homelessness, but also workforce development, health policy, social safety net programs, and criminal justice and a range of other issues. I share the reaction that many of you had, that any kind of central solution has to be about housing, and specifically housing that's affordable to people who are experiencing homelessness. When we did a study a few years ago, we discovered that people experiencing homelessness who are working are earning an average of $9,000 a year in California. So that has to be a guide for our thinking around what is affordable. And I'll just end by saying that the other side of that equation, of course, is income. And so any sort of secondary or complementary solution should be focused on increasing income. And for this population, that could focus on access to the safety net programs that already exist and making them more accessible and easier to apply for people who are eligible for them. And thanks for including me.
Thanks. Doug Shoemaker.
Hi, I'm Doug Shoemaker. I'm the president of Mercy Housing California. Nice to see so many familiar colleagues. I think that one of the things we have to just acknowledge is that we're probably not going to solve homelessness if we don't start preventing it better. And so from my perspective, you know, I think a tool that we need is a more flexible funding and rent subsidies, income supports for people that are not yet homeless. Because I just don't think we can keep trying to bail our way out of bail the water out of the boat, which seems to be our current strategy. Thanks.
Thank you. Sean Spear.
Hey, good morning, everybody. I want to echo the comments of others. It's great to see a lot of familiar faces as well as people I've heard of in the industry. So I'm really looking forward to working with you all collectively on this challenge. Sean Spear, President and CEO of Community Housing Works. We are a statewide nonprofit affordable housing developer and owner based in San Diego. We serve primarily working families, seniors, those with special needs, and including also supportive housing as well. I also chair the San Diego County Continuum of Care Advisory Board, and coming up with local-based solutions for addressing the housing crisis here in San Diego. I think you've heard a lot of great ideas here. I think in part it underlines the fact that there are so many different needs in order to comprehensively address homelessness and preventing homelessness for folks in our communities. One that I would sort of amplify, though, is think creatively about how we not only build affordable housing and supportive housing that address those that may be at risk of becoming homeless, but that we also think of a number of different ways of bringing those types of developments forward, whether it is 100% standalone supportive housing, or it may be a sprinkling of supportive units with access to services directly in an otherwise family or senior development. So I think there's a lot of creative ideas. Looking forward to hearing everybody's here and addressing this terrible need that we have to get to. Thank you.
Thank you. Reba Stevens.
Yes, good afternoon, everyone. It is truly an honor always to be invited to a space to have conversation, to affect change, particularly around those who are currently unhoused or falling. Shucks, I forgot everything that I was supposed to say. So I'm a community advocate. I have lived experience and many of the intersections of homelessness as well, which is 21 years of being unhoused, criminal justice involved, mental health needs, as well as 21 years of drinking, using, or abusing drugs and domestic violence. Just to say a few. I think that when I think about the question, I focus more on the area around the area of focus. And one thing that I didn't hear today is the importance of a foundation. How do we create and build a solid foundation for those to stand upon in order to not only get housed, but to remain housed? In addition to that, to learn how to, really enter back into society and be productive and to be able to live inside. And so that would be, for me, it's about being creative and innovative. Certainly we need housing, we need lots of housing, we need a lot of money, but the truth of the matter is what we need too, that's not often uplifted is, you know, how to live, living life skills, going back to basics. I would hope that this group would be interested in going back in time, maybe about 40 years. Take a look at what worked then and as opposed to what's working now, and also focus on lessening enabling of folk who are currently being served. Lastly, I would say that it's really important that we not only look at people falling out of home and into homelessness or returning, but we look at those and focus on those who are able to maintain their housing. What are they doing? What's working? And really adopt it. So thank you. And this is really the last thing. Hello, Corinne. It's so good to see you. And hey, Dr. Mark. Thank you.
Thanks. Megan Van Sant.
Thank you. I'm Megan Van Sant. I'm a senior program manager at the County of Mendocino. The focus of my team that I supervise and work closely with is on initiatives that cross departments and cross between county services and community services. So my team is the administrative entity for our local homeless continuum of care. We manage a Project Home Key site in Ucla from round 1. We also manage the Project Room Key program. We were also we managed our local whole person care program that has now transitioned into CalAIM. So we're kind of the primary point people in County of Mendocino for the CalAIM initiatives. We have a pretty new, complicated, challenging collaboration with our criminal justice partners. And we also are recent recipients of a Family Homelessness Challenge grant. So I kind of think of my work is very on the ground within the County of Mendocino structures. I don't want to echo what everyone else has said because I agree with everybody else's focus, but so I was just going to narrow my response to the prompt question in terms of one visionary concept, as well as one specific policy tool that I thought maybe we were supposed to also offer some specific policy tools, but maybe now's not the time, but I'll do it anyway. So in terms of an area of focus that's more visionary, I think that it would be helpful for social services and homelessness advocates to really figure out ways to have collaborative, symbiotic, positive, and trusting relationships with the criminal justice system. I do notice that we don't have criminal justice system partners here, and whether we want it to be true or not, that system is heavily involved in the experience of many people experiencing homelessness, and some sort of positive relationship with them, I think, is going to be critical to the overall goals that we all share. In terms of a specific policy tool, I'd like to throw out there the idea of working towards rental assistance vouchers being issued to every former foster youth who's aging out of foster care up to age 30, kind of linked to their Medi-Cal automatic eligibility. I think if I want to echo what some of the other members of this committee have said, if we don't simultaneously work on prevention and we don't actually put policy in place to the people we know are most at risk at a young age, we're never going to get ahead of this project. And former foster youth is a state responsibility. Seems like it's fairly clear population to focus on with a automatic rental assistance voucher. And I'll stop there. Thanks.
Thank you. Alex Visotsky.
Hi, everyone. Alex Visotsky. I am the California Policy Fellow for the National Alliance to End Homelessness. And I want to say thank you to Secretary Galley and Secretary Castro Ramirez and all the Cal ICH staff for convening us. Really appreciate the opportunity. In terms of, one area of focus that is central to ending homelessness, I think I've got to say racial equity. I think, when we look at the barriers to housing for Black people experiencing homelessness, for Indigenous folks experiencing homelessness, for people with disabilities, when we look at those barriers and address those barriers, we're going to be addressing the barriers for everybody and strengthening systems for everybody. Thank you.
Thanks. Javon Wilkes.
Good morning, everyone, and thank you, Giselle, Cody, Mark, and Lourdes for this opportunity. Javon Wilkes with the California Coalition for Youth. I'm the executive director. We are a public policy and advocacy organization with members throughout the state of California. We also run and operate the California Youth Crisis Line. And of course, one of my areas is really focusing on a great solution that California have, which is to prevent and end youth homelessness, because we have, as Megan has stated before, we have too many young people that are exiting systems of care into really just bad situations with homelessness. I'm a former foster youth, been homeless as a youth, and also gone through other systems of care. And so really appreciate the opportunity for us to be here. And of course, one last thing, which is one of the biggest opportunity I think that we have is really just being together. We are the opportunity, and doing this work together is really going to be the way in which we also bring our minds, our hearts, and the work together to make sure that California is a place where people have a foundation, where people have family, and where people can reach their full potential and thrive. So thank you so much for this opportunity.
Thank you. All right, and last but certainly not least, Roxanne Wilson.
Good morning, everybody. Thank you so much. I'm listening to all of my colleagues, and somebody had said this is like the all-stars of the homeless sector, and I absolutely agree. When I was going through the announcements and seeing who's here, I'm like, wow, what a humbling experience to be a part of such a group. So thank you all for all of the work that you do, and also especially thank you to Cal ICH for pulling this together. So for me, my name is, again, Roxanne Wilson. Sorry about that. I work for the County of Monterey as their new homeless services director, but I'm mostly known for the work that I did when I ran the continuum of care for Monterey and San Benito counties. We did a lot in a very short period of time, and our community has seen a decrease in homelessness. From 2017-2019, it was 18%. From 2019-2022, it was 15%. So one of the things that I will say is we are struggling with the feeling that we're being penalized because of the funding that changes every time your pit goes down. That is something that I really would like for us to consider, is how do you incentivize communities for having a point in time go down. And another thing is I would love to see the people experiencing homelessness as a protected class. The situations that they face because they are homeless in medical care, in housing, in everything is unreal to me. And we have got to do something that is really aggressive to break down those barriers. And then finally, I would love to see mandated data sharing. There is we can't help people if we can't speak to other folks who are helping the same exact people. And while we are trying our best to figure out how to do that, it would be more effective, I think, if the state of California mandated it. And that's all I have to say. Thank you so much.
Thanks, Roxanne. All right, before we move on, did I miss anyone? All right, I'm gonna take that as a no. Thank you all so much. Really, really appreciate it. It's amazing to see and hear from all of you. Just goes to show what a depth and variety of vision and perspectives we have in this group, and really excited to see how those combine and support our work going forward. So we adjusted the schedule. We have two more important things to do. Basically, we're going to skip most of the background information that I was going to provide on Cal ICH. It is already in your briefing packets. It was just sort of another summary of that. The PowerPoint slides will be available after this meeting, so you can go through those, and we're happy to set up meetings to talk with each of you individually to talk about if you have questions about sort of what Cal ICH does. Additionally, at our next meeting, we'll be able to cover that. So there's sort of two more important things to do. First, we're going to do the oath. We're going to swear everyone in right now. So we'll do that really quickly, and then we'll take public comment. So I know we're running a little behind, but if committee members are able to stay, that would be wonderful. So the way the oath is going to work is that we're all going to get sworn in together. Or you all, sorry, we'll get sworn in together. I will administer it. You'll be saying it together. I'll read one line, and then you can repeat it after me. And we'll read one line by line. So if you all could unmute yourselves, this is going to be sort of fun. And
cool.
Yes, great. Okay, so I'll start and then just repeat after me, sort of line by line here. So I, your name, do solemnly swear.
I,
solemnly swear
swear
That I will support and defend the Constitution of the United States and the Constitution of the State of California against all enemies, foreign and domestic.
That I will
That I will support and
and
defend the Constitution of the United States and
States
the Constitution of the State of
California
California
against all enemies,
all enemies, foreign and domestic.
That I will bear true faith and allegiance to the Constitution of the United States and the Constitution of the State of California.
That I will
That I will bear true
faith
faith
and
and
allegiance to the
Constitution of the United
Constitution of the United States and the Constitution of the State of California.
That I take this obligation freely without any mental reservation or purpose of evasion.
That I take this
obligation freely without any
without any mental reservation or purpose of evasion.
And that I will well and faithfully discharge the duties upon which I am about to enter.
And that I will well and faithfully
discharge
discharge the duties on which I am about to enter.
All right, amazing. Thank you all very much. That was wonderful.
We would
Thank you for
not be a
doing that.
good church choir.
It's hard on Zoom. It's hard on Zoom. Well, congratulations. We're happy to have you as official advisory committee members and collaborate with you all on the best approaches to preventing and ending homelessness in our state. We want to just take really quickly, I'm going to make this view a group gallery view. We're going to take a screenshot to celebrate. So if everyone could turn on their cameras if you're able to. We're going to take a couple screenshots right now. So 1, 2, 3. And one more. 1, 2, 3. Great. I think we're good on that. All right. So last but also not least, I'm gonna skip over the next agenda item, which is the background. As I said, please feel free to reach out with questions about Cal ICH. We will also make sure to cover a lot of this conversation or a lot of these topics in our next meeting. So Giselle, I'm going to pass it to you to facilitate public comment.
Thank you. Now we will do a general public comment for members of the public. Thank you for joining us now. And thank you, Daniela, for sharing your screen. All right. I'd like to remind everyone that we are unable to discuss items not on the agenda for today's meeting. Additionally, due to the structure of this meeting, we will not be able to respond to any questions. If you have any questions for Cal ICH or the committee, the best way to reach us is to email us at calich@bcsh.ca.gov. Everyone will have 2 minutes for their comment. A Cal ICH staff member will soon share their screen with the 2-minute timer. Thank you. If you're connected through Zoom, please select the raised hand icon in the meeting window. We will unmute you and allow you to comment. For those joining us by phone, you may press *9. You will then be indicated to press *6 to unmute yourself. All right, I'm going to go ahead and check if we have any raised hands. Teddy Pierce, you should be able to unmute yourself. Go ahead and state your comment. Teddy, are you able to unmute yourself? Okay. Teddy, it looks like you should be able to speak. If you would like to follow up with us, please email us. We have no more additional comments.
Great. Okay. Thank you, Giselle. And yes, please feel free again to follow up with us if you had any comments or questions. We will, include our email address in the PowerPoint presentation that's uploaded. So thank you all. That was the meeting. Thanks again to all of our committee members for your insights and comments today. We really, appreciated it. We're so excited to get this group moving. We look forward to seeing you again also in our joint council and committee meeting on November 10th at 2:30, which we'll provide you more information about via email. I also want to thank the members of the public who've attended this meeting. We appreciate all of your interest in our work around homelessness. And I know many of you who attend our meetings also work to address homelessness either at the state level or in your local communities. So we appreciate all of your efforts as well. To receive any up-to-date information on the council activities, please sign up on the council's email list. There's a sign-up option on our council's webpage. And with that, the meeting is adjourned at 12:13 p.m. Thank you all very much.